Hi everyone, welcome to Center of Balance Live. I'm Szenan from Center of Balance, the acupuncturist. Hi everyone, welcome to Center of Balance Live. I'm Szenan from Center of Balance, the acupuncturist. Today our topic is lower back pain treatment. Today our topic is lower back pain treatment. So those you are an acupuncturist, now today is your lucky day. Why am I saying that? Because when it comes to treatment, as most people want to know about the treatment point, the acupuncture point, the acupuncture strategy. This is the day that I'm going to share with you the acupuncture treatment for lower back pain. So it's easy one, it's quick one, in no matter what back pain here, and you see all this meridian involved, then you can put this needle in. Right. So we talk about pain over here, UB meridian, 2 meridian, and on the side, GB meridian, gallbladder meridian. So all this meridian, I'm going to give you a strategy for those, okay? Even the pain down to your legs, okay? All this meridian. So we have few strategy. So I want to be prepared. Watch this video until the end, because I'm going to give you this point strategy, an acupuncture one. We call it quick and dirty way. Quick and dirty way strategy of acupuncture treatment. I'll give it to you all this point, a few, not just one, a few of them. So you need to prepare with pen and a paper to write it down, okay? Because I don't have whiteboard here, I can't show you here. I'm going to show you this, but you probably can't read it properly. I'm gonna name. Oh, right side. You're gonna put what point, something like that. Okay, I've got this card in here. Right. Hi, Veronica. How are you? Thank you. Good morning. Good morning, Eric. Good morning. You're welcome. We're praying for everyone in the temple. Thank you. Right. When you hear on the live, please say hello to me and tell me how is your morning. Maybe it's your evening. How is your day? You may be still in, your country still locked down and you're still at home. You can't work. Let me know, what do you do when you're not working at home. Hi Ali, how are you? Thank you for being here with us. Thank you. Okay, yeah, let us know share your story. Share, what do you do at home? Or are you back to work yet? Let me know if you're back to work. Right? If you are my patient, yeah, let me know, what do you do yesterday, on Sunday? Was it a family day or church day or whatever you do? Share with me, please. We went to temple, so 7 o'clock and 8 o'clock. 7 o'clock I did the live video, and 8 o'clock we drove here over there to about 1 hour 15 minutes, arrived there, and then we got home about 7:30 last night. Yeah. Oh no, probably 7 o'clock. Yeah, something like that. You have back pain, right? Today is your lucky day. If you have back pain, the reason I say it's a lucky day is because we're gonna tell you what strategy point that you can use for your back pain. All right, for your back pain. For all back pain. We're talking about for all back pain. No, just 2:15 p.m. still locked down in Peru. Okay, I understand. Yeah. Now, if you're here watching this live video, please say hello to me and thumbs up. Okay. Now, the next action, if you're on Facebook or on Instagram, please tag your friend in, your colleague, your family who want to know about lower back pain treatment. Right? We're talking about Western medicine treatment as well as Eastern medicine. Okay, Eastern medicine. Then what else? Please share this video, share this live video with your friend and family, share onto your Facebook page. If you're on YouTube, please, when you finish all this, take the link, YouTube link, and share on your social media. Please, can you please help me with that? Share this knowledge and information with everyone that you know. They might need this. Okay. Veronica said the monk can bend his big toe now. No pain now. Very grateful to you. Oh, thank you. Good to know. And all the best to you in the monk. Thank you very much. Right. Let's start the topic today. Lower back pain treatments. Right. We talk about the diagnose, right? The diagnose can be MRI, CT scan, X-ray, blood test, and physical examination. You know, we talk about all this. Those diagnoses are trying to figure out what sort of back pain, right? But in Chinese medicine, we have our own way to diagnose according to traditional Chinese medicines. So one of the way is Meridians Diagnosis. So what is Meridian Diagnosis? Okay. So look at it, say, oh, I have back pain over here. And we're gonna check, oh, okay, pain over here. Let's run through this meridian is UB meridian. How do you say I'm an acupuncturist, but I'm beginner? No worry, beginner is the best, because when you're a beginner, you watch this live video, you suck in a lot of information and knowledge. And my live video would be, I believe that my live video daily will help you in your with your treatment with your patient. So step by step follow my live video. I always go through, like for example, in back pain topic, what is back pain causes, back pain symptoms, how do you diagnose it, what treatment of back pain in Western medicine. So you know when your patient comes, they may already take the medication. And more importantly, you want to know what are the side effects of medication. Then you're going to ask your patient, if your patient have constipation after medication, then you know this is the side effect of it. But if your patient have other symptoms, then like dizziness, and you need to ask, when did the dizziness start? Was it before the medication or after the medication? You need to ask this. Then further on, you want to ask what? You want to ask, well, how bad is it? How often does it happen? Have you reported this to your doctor yet? You know, you need to ask all these questions, because the patient have the right to know the side effect of the medication, and the patient have the right to choose whether they want to take the medication or not. If they choose to not to take it, but they need something to help them, so you need to offer the back pain solution, the back pain treatment solution to your patient, for them to choose what is right for them and without any side effect like dizziness. If they happen to have a dizziness of the side effect of the drug. You understand me? So this is important. Otherwise, the patient keep taking the medication with dizziness, the back pain may not, it's not a risk for the life. But the dizziness may be a risk, a trigger of the risk of taking off their life. Why am I saying that? Because think about it, if imbalance, you get up and you get dizziness and you fall off and you hit something on your head, that become an accident. And they may cause concussion or stroke. So you need to understand all the side effects, how bad would it lead to. So you discuss with it. We're not here to scare patient. We're here to give information. And we're here to give them information, knowledge, and they have the right to know that. Right? Ali said, do I use Dr. Ju's scalp or Dr. Tan balance method? Now today we mainly talk about Dr. Tan's balance method acupuncture. Okay, I'm going to give you the point strategy in the end of this live video. Okay, so stay with me. Keep watching this live video. So be patient. Okay, be patient is the first thing. Right? We're going to talk about the Western medicine first. Okay, and of course we're going to talk about the side effect of medicine. Right? If you don't know the side effect of medicine, you can't talk to patient. And guess what? You don't have to know all the side effects of the drugs. To be very honest, this is how I start. I can remember a lot of side effects of the drugs, but I can't name out all the side effects. Okay, I try to memorize all the common one, right? Common one. But you always miss something. You will remember most common side effects of certain drugs, but they are less common. They are less common. Okay. Then what do? Simply Google it and put it on the screen on the computer. So when patient come in, I sometimes Google in front of patient. So you say, well, let's check about this medication side effects. And I go through it. I normally do it before patient come, the new patient come, okay? Because they put it in the form what they take. So I review it first. If I still can't remember that, I just pull it out and show patient. You see this drug have side effect. This one have side effect. This is the most common one. This is the less common one. And you have this symptom, and it match the side effects of the drugs. And I want to know about it is whether this condition that you have, which match the side effect of the drugs, are they happening? Were they happening before the drugs or after the drugs? I need your answer. So you ask the patient, because you're not a patient, you don't know where it actually happened. Is it related to the drugs or not? You see, so you ask the patient and let the patient realize it what may causing the drugs. If the condition come after the drugs, and the patient need to know that. And why is that? Because they need to go back and discuss with the doctor. They change it down, change the doses, lower down the doses, or stop the medication, or change to other medication that they won't have any side effects. Does it make sense to you? Hi Nida, how are you? Happy day, how are you? Thank you for being here. Can I contact with you on WhatsApp? I'm sorry, no. No personal contact in WhatsApp for me, Ali. I'm sorry. That I'm here to help you. You will get benefit from the back strategy point in here. Yeah, I can't give you a proper diagnose or whatever because we can't see you, but you're gonna make your diagnose yourself and you're gonna use the point yourself. Okay. Yeah. I don't have time to do personal call and teaching you. No, but if you want to, we have local balance. We have local balance um, webinar, and you can buy that and learn it step by step. And I recommend you do that because that will help you have more clear of in your mind how to diagnose everything according to balance method acupuncture. Right. Hi Amida, how are you? Thank you for being here with me. Please give me a thumbs up and share this video on your Facebook and tag your friend into this Facebook Live. Thank you very much. Let's talk about lower back pain treatment. So very common that back pain patient take painkiller. This medication, okay? The majority of back pain episode will live by treatment with NSAIDs drugs, okay, which is ibuprofen and naproxen, okay. Is you can buy this in the shop, okay. You don't have to need to prescription, okay. You just take it and pay it and take it, okay. And the other common drug is called Tylenol. It's a prescription. It's a prescription, okay. So you need to be careful if you're a patient or you are a practitioner. You need to inform your patient that be careful with the painkiller like ibuprofen if you have a kidney problem or liver problem or stomach ulcers. Then ibuprofen maybe cause those kidney, liver, and stomach even worse. Okay, need to be careful about that. Okay, so never take the more than the recommended doses. All right, especially the over-counter medication. Okay, this is important. Okay, now let's talk about ibuprofen side effects. Okay, stomach pain. Now, stomach pain, heartburn, nausea, vomiting, gas, constipation, or diarrhea. Right. So I'll tell you, most people get constipation, right? But they are case get diarrhea. Okay. Most common is constipation. Okay. Now ibuprofen is very good for muscle pain. Okay, very good for muscle pain. Right. So there are what I just named out is the most common side effects. Right. So what about the serious side effect? The very serious side effect, it can lead to heart attack and stroke. Heart attack and stroke. Okay. If the patient increase and get too much ibuprofen, they can increase the risk of heart attack and stroke. And what else? If the patient take it for a long time, chronic pain. When the acute pain becomes chronic pain, why is that? Because it can form the clotting issues. Now, your doctor wouldn't test you for whether you have clotting issues or not. Hey, let's take a blood test and see whether you have clotting issue. If you have, don't take ibuprofen. They won't do that. And ibuprofen is over-the-counter drugs. You can buy it anyway. You don't need a doctor prescription, right? So if you have a stroke problem, you have a heart problem, you want to take ibuprofen, you need to be careful, right? Because you may have clotting issues. So that actually increase the risk of getting stroke and heart attack. So you need to be very, very careful about it. Other than that, kidney function and blood pressure. Now you probably won't thought about that. It can bring up your blood pressure. It can damage your kidney if you take it for long term. Sometimes not need to be long term, within a couple weeks or months, within a month, then you feel it. Okay, so and of course it can cause dizziness, um, urine issues, the less frequency. Okay, and the fluid build up the fluid. So when it less of urine, fluid build up in your body, that's how it bring your blood pressure high because too much fluid in your body. Okay, so this is important to know. And also stomach, it causes bleeding in the stomach. It causes bleeding in the stomach. So do not use it with alcohol. Right? Do not use it with alcohol. So there is a liver failure issue as well. If you liver function problem, don't take it. Don't take it. Okay, or it may cause it if you don't have the uh, uh, um, um, if you don't have the stomach problem, a liver problem, it may cause it. Good. Now, allergy reaction, it may have allergy skin problem, okay, uh, but or breathing issue, okay, but very rare, but more often with aspirin. Okay, aspirin is another painkiller that people take commonly. Okay, now you see this ibuprofen can damage your liver, kidney, stomach, and spleen function, and what else? Gas, stomach, yeah, and maybe skin problem, lung and large intestine, and it can damage your heart as well. So one simple drugs, ibuprofen, it can, it may damage, affect your organs, all of the organs. How powerful is that? How powerful is that? Sometimes came to my clinic with spasm muscle. Can I relieve the muscle with acupuncture? Painkiller is bad for kidney and liver. Yes, yes, of course. We're gonna give you the strategy. Okay, we're gonna give you the strategy, and you know how to treat the muscle spasm, back pain. Right? Simple, very easy. Okay. The more common side effect that with naproxen. Okay, look, very similar one. Stomach pain, common. Constipation, similar to uh, uh, ibuprofen, right? Diarrhea, gas, heartburn, nausea, and vomiting, and plus dizziness. Dizziness, right? We didn't talk about dizziness in ibuprofen, but that's coming up with dizziness. Okay, right. So this drug is often used for back pain, okay, back pain or arthritis. Okay, when we talk about arthritis, we talk about that as well. So just now, I just named all this uh, um, side effects. Conditions are most common one, right? Now, the serious side effect. What are the serious side effects? Okay, the serious side effect may be chest pain. Chest pain. Have you ever thought about it? Chest pain. You want to treat your back pain, but you end up with chest pain and shortness of breath and trouble breathing. Trouble breathing can be heart or lung. So lung, heart, and the common the common one that we talk about: heartburn, stomach pain, stomach and spleen. Three different organs now. You know, stomach and spleen. Then the other two. Let's see whether we have matched the other two as well. So bleeding issue, also stomach problem. You know, stomach problem. um, you may have a difficulty speaking, like stroke. You know, and weakness in one part of your body, on one side of the body, right? And blood in the stool, blood in your bowel motions, okay? Asthma attack. But you take it if you have asthma, then you start to get wheezy. I can't breathe, something like that, right? Can't breathe properly. Okay, skin rashes, skin itchiness, blister with fever. What is it? That is lung and last mutation because lung control all the skin. That's another one, right? Right. Blood pressure. Okay. Right. About this, so you have 4 different organs that related to this drugs. All right. So that's important to know. That's important to know. Okay, you need to know that. Okay. Tylenol. Tylenol is a drug that is prescription. You can't get it over the counter. Okay. And then guess what? The side effects, most common side effect is very similar to the other 2 drugs that we just discussed. Okay. One of them, okay, stomach pain, nausea, loss of appetite, itchy skin, raise, headache, dark urine, and dark color in your bowel motion, like bleeding. Bleeding. Okay, so that is not fun at all, isn't it? Not fun at all. So you can get dizziness as well, trouble breathing. Okay, so dizziness, liver and gallbladder issues, trouble breathing, lung and large intestine issues, skin problem, lung and large intestine problem, heartburn, loss of appetite, um, stomach pain, stomach and spleen problem, right? Then what else? Bowel motion problem, then it can be stomach and spleen, right? Urine, okay, urine problem, dark urine, frequent urine. Then it's kidney and bladder problem, right? Right. So we have about 4 organs, different organs that involve side effect involved with the organs according to Chinese medicine, right? You see the symptom, you know what they're actually for. Okay, now they are something that they may not, your doctor may not prescribe to you, like not apart from painkiller. If it's getting worse, it may give you opiates. Okay, opiates, oxycontin. Oxycontin is one of the common opiate drugs. Okay, then you need to know oxycontin side effects. Okay, so it can be oral one. It can be again. It can be injection one. Okay, but normally you take it oral. Okay. Let's have a look at the side effects. And to be honest, I'm not very familiar with these drugs because when you look at the patient, they do use it. They do use it, but less common in your clinic because we see more patients taking ibuprofen and Tylenol and naproxen or aspirin or warfarin, okay, all these drugs, but less to get opium. Okay, I did have a patient who, I just had a patient, new patient last week who had 21 surgery in her life, and within 10 years, 21 surgery. Can you believe it? 21 surgery. Hip replacement. She's only young. She's only about 40, 40 something. And hip replacement, abdominal pain all the time, constant, and keep going and find out what's going on and remove hysterectomy, remove uterus, remove ovary, one of the ovary, try to keep the other ovary to balance the hormone, all this thing. You see, that is terrible for her. That is so, poor thing. That 21 surgery in 10 years. That's not good. Now, okay, before using the drug, the doctor may want to ask you about allergy. Do you have any allergy for it? If you have allergy, they may not give you the opium uh, uh, um, uh, prescription. Or are you breastfeeding? If you're breastfeeding, they won't give you this drugs. Okay, they won't give you this drugs. Um, let's have a look the side effect of it. Okay. If I can find it, I just because okay side effect. Uh, what is the side effect? Let's have a look here. I'm gonna write it down. Read it for you. Less common side effect is cold sweat, confusion, difficult in labor breathing, can't breathe, faintness, dizziness, lightheadedness. Okay, and it gives you Saturn from laying or sitting position, right? Fever, tightness in your chest, twitching, okay, rear, bloating and swelling in of the face, arm, hands, lower legs or feet, blood in the urine, you see, burning while urinating, okay, burning when you urinating, okay, pins and needles, tingling feeling, chest pain, cough, decrease in the frequency of urination, decrease urine output, the amount of urine, difficult or painful urination, difficulty in passing urine, dribbling, okay, difficulty with swallowing, and dizziness, dry mouth, fainting, fast, irregular pouting or racing heartbeat or pulse, feeling of warmth or heat, flashing or redness of the skin, especially of the face and neck, frequent urine, headaches. There's a lot, to be honest. There's a lot seizures, and maybe seizures, stomach pain, eyes problem, thirsty, very thirsty, and vomiting. You know, well, they may be unknown. They are huge, a lot. I didn't realize that there are a lot because we don't have many patients that who on opium. So I really rare that I actually check on this drug. So yeah, good to know. I'm learning as well while I'm finding out the answer for you. Okay. Now, the other, the other a new friend here, Nani. Nice to meet you. Nice to meet you. Thank you for being here with me, and Ali in Facebook as well. Ali on both in Facebook as well as um, YouTube. Thank you. So, do you know that with back pain, severe one or long-term one, and a doctor actually prescribed an antidepressant? I been asking this question to my patient. I say, well, you're in pain. Why are you in antidepressant? He said, I don't know. My doctor prescribed me. It's the thing that may help me with pain. When doctor prescribed the antidepressant, the doctor suspect the patient had a depression and suspect the pain actually causing patient depression, or patient have a depression issues that causing the pain. And the next question you ask the patient is, since you're on antidepressant, what is the more common antidepressant? Amitriptyline. Amitriptyline is a drug for depression. It is an antidepressant. So I ask my patient, now since you're on this drugs and amitriptyline, did you get better? Did you feel it helped? How long have you been taking it? Does it help at all? And most of the time, if they didn't realize they have depression, most of the time they think, I'm not quite sure why I'm on this drug. I don't have depression, and I say, do they help your pain? No. They don't. So why are you taking it? And they start, since we question and they start to question it. You say, I don't know, my doctor just prescribed. I said, did you ask that? Why did they prescribe that? They didn't. So a lot of my patients with pain and doctor prescribes their antidepressant, they take it for years and they still have pain, and they start to question it and they go back to ask the doctor, and the doctor stop the medication for them because they haven't found it's helping. So you see, this is one of the way that we cut down the medication for patients. We stop the medication. Why do we need to do that? Because back pain won't kill them, but the drugs may cause more harm than good. Now I'm showing you how to question the drugs of your patient, if you're a practitioner, and I'm showing you how to question your doctor when they prescribe drugs for you. If you're a patient, if you're one of the patient on my Facebook page, you know I ask this question. So I'm questioning all this time to you because I doubt that you need these drugs. But I do have patients who have depression and they are Amitriptyline, and I ask them, well, since you're taking this, does it help? And they say yes, and that's good. And I will say that's good, it helped. You find it helped because some patients try way off it and they get worse in depression. And they take it back and feel better. And I won't say anything because it helps. Then we're gonna go forward to see whether you have any side effect of the drug. If you do, you need to understand it. You try to control the depression with antidepressant, but does it really help? And does it cause other problem? If it does, then you have to consider whether there's any other method. The acupuncture Chinese medicine can help you. Were you willing to try that and give up your medication? But of course, when we say give up your medication, we do it step by step. We're gonna make sure I won't stop your medication straight away, and I'm not allowed to stop your medication. I would send you back to your doctor and discuss how to gradually weigh off the medication. That's the proper way to do it. Does it make sense to you? Right. Right. What are the side effects of amitriptyline? Okay. Dizziness, dry mouth, blue vision, the eyes problem, constipation, weight gain, put on weight. Who want to put on weight? No one want to put on weight. Okay. Trouble urinating. Okay. You can't pass the urine properly. Those are the common one. Okay. Those are the common one. Oops. The computer is very slow. I'm sorry. It's stuck right now. And different. So, do you have patients take amitriptyline when they have pain? Let me know. If you do, please say yes. Yes. If you're a practitioner, do you have patient? Do you have patient with pain, any pain, not just back pain, that on top of the painkiller, and they're actually taking amitriptyline, which is antidepressant for the pain. The doctor prescribes it them. Do you have any of this case? If yes, please reply yes. If no, say no. That's okay. Do you have any experience of that? Now, and amitriptyline, it may cause anxiety. So dry mouth, sore mouth, constipation, it may cause anxiety. Then it may give you have a thought of suicide. suicide thought, or it may give you harming yourself, like you try to harm yourself, and people try to, you know, I do see this, you know, if they have the sign, you need to ask them. They may have the suicide thought, and it's a serious problem, and you need to tell your doctor about this, and then slowly, quickly stop, the medication. So if you're a practitioner in front of this video, live video, happy day, say yes, yes. Okay, good to know. You do have patient who's in pain, and the doctor prescribes antidepressant, right? Same thing here. Common, very common. Hello, Praniyara, nice to meet you. Nice to meet you. Okay, what about the others? The other practitioners? Do you have any patient who's in pain and the doctor prescribes Amitriptyline? Okay. Now these are all the medication we talk about. All right. Now it may give you muscle relaxation, right? The doctor, may give you muscle relaxations as well. And steroid injection. If the painkiller doesn't help, the further on the western side, they'll give you steroid injection. Okay, of course, for back pain, they more common refer to physiotherapy, chiropractor, osteopath, acupuncturist. Okay, acupuncturist. Then if medication or treatment doesn't help, the further on they will say, well, suggest a steroid injection for severe back pain, of course. Okay. Further on, if injection doesn't work, then they will refer you to a specialist and for surgery. If the not It won't refer you for surgery if there's a muscle power. There is no surgery for muscle strain. Okay, so muscle strain is spasm is much easier to treat. Okay, when it comes to very severe pain, nerve compression, due to and the muscle become weak, you can't walk, you can't do your bend, the range of movement is not good, and there's a vertebrae problem, a disc problem, then you may consider surgery if nothing's working for you. If all you try is not working for you, then you may consider this. Okay. Now, apart from the drugs, surgery, after drugs or injection, if that doesn't work for you, you need to try acupuncture. And acupuncture is very good for you. It can help a lot of back pain. Then, if acupuncture doesn't work well, Chinese medicine or a combination of acupuncture and Chinese medicine or exercise. Okay, or exercise. If all of these are not helping, then you think about surgery. Okay. Okay, this is the time to talk to you about the acupuncture point. If you're a practitioner, this is your time. Now, this is more than 40 minutes now, this video. 44, come to 45 now. Okay, we're going to quickly go through the acupuncture strategy point, right? Yeah. So, painkiller causing anxiety. Happy day. Thank you for sharing this. Every day say a patient complain to him whenever the patient use the painkiller, he always get anxiety. You see, painkilling can cause anxiety too. Okay, so this is important to know. Not for everyone, but yeah, that happened. Now you need a pen and paper. A pen and paper because you need to write down all this point over here. Or you can replay it and look at this point. Alright. This is the point. Okay. Now I'm gonna name it now. Before I go through this one, I'm gonna give you easy one, okay? You see here lingu, this is last intention 4, right? Go down here in the corner, this is lingu point. Across from lingu and between those two metacarpal bond, and between those two and here. 1, 2, 3, 4, 5. Those 5 points we call it back 5 point. 腰五针. Back 5 point is a local balance for lower back pain. Either from here, 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 here. But the two probably not as good. So you on the middle metacarpal bond, on the bond, on top of the bond, you find the RC point, and you needle the RC point, and that can shoot no matter what. So 5 back point plus 1. That is for all the lower back pain. Okay, this is one strategy. Now, if the pain gone down to your legs, including Santa, what is Santa? Over here, 1, 2, 3. So make a first, the loose one, needle in here, slowly put it down. 1.5 tune or 2 tune needles, and needles. Go in from here to here. Okay, slowly put down, put it in. It's called Santa. For anything that pain going down to your legs. Okay, if you're an acupuncturist, I'm showing you, you know what to do. A combination, so 1, 2, 3, 4, 5, back 5 point with this Santa. Santa is with pain, that's tingling and pain radiating down to the leg. Okay, this is the local balance. Can we do global balance? Yes, we can. Elbow, knee. Okay, they are the level of L2. Okay, if the pain on L2, then you do global balance. Magical 12 back pain. Magical 12 back pain, right? How do you do magical 12 back pain? Let me show you. 3 in on the elbow, 3 yang on the elbow and here. Then over here, 3 in on the knee, 3 yang on the knee. So this is yang. The opposite side using yang as well. And here you needle in. The opposite side you needle in as well. So can we do this? 3 in and here, yes. And we do 3 in and here on that side, and 3 in and here on the knee. 3 yang, then there's 3 yang, there's 3 yang there. So 3 hand in, 3 hand yang, 3 foot in, 3 foot yang. You needle 12 meridian, 1 needle each meridian for back pain. Now what we said about is, this is L2. Well, if it's L4, you lower down. Okay, so how do you lower it down? You can get RC point. You can go and press it. Oh, you have pain over here, 1 needle. You can do that too. Okay, get the most sensitive point from here to here. If the pain all along the back. It's not just simply on the same level. You can go from here to here, get the most sensitive one on one point, from here to here, each meridian. Each meridian, catch it from here to here, get the most sensitive one needle. All right. Then this is global balance, and it can combine with local balance. A bit more needles, but as I say, it covers all the back pain. I'll tell you what, in the past when we were in the medical school, we study in the textbook, it say our master said, well, if you have patient, we know acupuncture is good for back pain, but if a patient who come in with can't control urine and bowel motion, which means there's a nerve damage in there, compression the nerve is much lower, compression the nerve over here, and it's very serious problem, then you have to send them to the hospital emergency, and they need a surgery straight away. That's not the truth. That's not the truth. Why is that? Because we have cases in our clinic that we treat this case without surgery. Now, I'm not saying every cases you can use Chinese medicine or acupuncture to fix it, to control it, to make everything right. I'm not saying this because we haven't got enough data to prove this. But we talk about case, some cases. Right? If we can do this, then you may be able to do that. Okay. Now, with this strategy I just showed you, right? Medical 12 back pain, dun, 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 and 5 back pain. Right. So I have a student in China a couple months ago. He sent me the text. He told me that, wow, thank you, because I just fixed a patient who with severe back pain. Severe back pain. As soon as he did that case, he sent me that afternoon. I received that. He said, thank you for your sharing, because I did that for free for the class at this video. And I did 2-hour webinar for free for a lot of people. And he learned it and he used it. The patient came with a lot of pain in lower back, and the patient said that he can't walk properly, and urination and bowel motion lost control. Wow, you see, it's serious. He put needle in according to the strategy that I just showed you. Okay, then pain reduced a lot, and the patient can walk. That's good. Then he gave Chinese herbs as well. So Chinese herbs to the patient. 2 weeks time, everything's fine. You see, in the textbook, way back in the school, our teacher said, well, you need to send them to emergency for surgery. But not really. Not for all cases. Okay? So this is open your mind. See how serious. How do you know it's gonna work? You don't know. Needle it. Needle it and find it out yourself whether you get result or not, whether the patient respond to the acupuncture or not. Okay? That's the only way you can find out. So please don't come to me, oh, I have a patient who have this back pain, and what's the best strategy for it? I don't know. I'm going to share it with you. And which one would help, which will be the best for it? If you have tried, you need to let me know what strategy have been used. Then I won't suggest you the same thing. You know, if you haven't tried, I just show you that strategy, try it first. If it doesn't work, you come back to me. But if you haven't tried it and you try to get more information from me, I'm sorry, there's no more information. I want you to try it first. Does it make sense? If you already know that my strategy and you still worry about, hey, will it work or not? I don't know. I haven't got the right answer for you because I haven't seen the patient, and Simply just needle the patient and figure it out yourself whether it works or not. Take actions. If you don't take action, you never go there. You want to understand everything, all the theory, and find out the best strategy for your patient before you needle your patient. I'm sorry, too late. Take actions. This is important because I have a lot of patients. I have a lot of colleagues come and ask me, "What's the best strategy for this? What's the best strategy for this?" I don't know. If you try the acupuncture, you let me know what have you been trying, what point have you been using, what the strategy in the past, so I can suggest different strategy for you. If you haven't seen the patient yet, don't ask the strategy until you see the patient. You have your own strategy. You try it. It doesn't help. Then you come to me and you post it on the Facebook. I think that will be more. It will make sense to me. But of course, you still able to post anything you want in Facebook, but just say, well, I haven't seen the patient yet, but I'm not quite sure what the strategy would be. Uh, would anyone share your strategy? And that's different question, and that's different purpose, right? You are finding more information of it. All right. This is something I want to know because I see a lot of people ask in different group, and I don't have the time to talk to you all about this, but I want to say something in here today for a practitioner, if you're a practitioner. Okay. Now, next strategy. So the strategy that I just show you, that's one strategy. Local balance. You can just use local balance, or just use the 12 magical point back pain. That's global balance. Or you can combine local balance and uh, global balance together. You see what I mean? All right. So a few strategy in there. There's another strategy, global balance, that is from Dr. Tan. This called Dr. Tan's Magical Back Point 8+1. It comes with Bagua balance conversion. But you need a pen and a paper to write down the point. Okay. You need a pen and paper. So I will post it on our group, practitioner group. Okay, practitioner group. All right. You won't get it in the page. We're doing the live video on the page, but you need to join the group. I'll take a picture and put it on the group. Okay. Today I'll do it today. I promise. Okay. Linku. Perhaps I should do it now. Otherwise, I forgot. Okay. Let me take the picture. All right. I'll show you this. Okay. I'll show you this in here. Okay. On the group. I'm going to share in the group right now. So if you want to see this, you have to join the group. And I'm going to name it one by one to you so you can write it down too. Then we're going to share all this. I have a lot. If a practitioner, I'm going to share all this strategy point. All the strategy point. A lot of disease that you can use it here. So one by one. You can treat heart, digestions, diabetes, high blood pressure, So all this thing, we're gonna treat you can get all this in our Facebook group, practitioner group. Okay. So I'm gonna post it right now. If I can find a group, yes I can. I'm pretty sure I can. Pick to zoom in on photo. Okay, what am I saying? This in here, I'm gonna put it down to Dr. Tan. So you're gonna write the name. The strategy name is. Oops. Just in case I forgot after this live video, I'm going to do it right now. So if you're on the group, you will see it quite soon. You type it, Dr. Tan, medical back pain 8+1. So why 8+1? I'm going to explain that to you later. This is Phua balance, Meridian conversion. Okay. Phua balance for all back pain, all lower, for all back pain. It can treat upper back pain too. Okay, this one is different, not just for lower back pain. Although we're talking about lower back pain, right? Medical back pain 8+1. Okay. Pose. Okay, I pose it over here. There you go. So it's in our Facebook group. On the group, not on the page, on the group. Two different things. Okay. All right. Hi Hassan, how are you? Nice to meet you. Okay. Now, have you got your pen and paper yet? I'm gonna read down the. If you're not on my group, you won't see that this. Okay, so I'm gonna read it down for you. Okay, on the right side, right hand, you do large intestine. That's lingu point. And on the right hand again, it's all right hand. Okay, small intestine 8 and 3. Small intestine 8 and 3. 三焦 10 and 3. 三焦 10 and 3. Okay. Now on the right side of your foot, kidney 10 and 3. Kidney 10 and 3. And liver 8 and 3. Liver 8 and 3. Right. Then on the left side, on the left hand, lung 8 and 11. Lung 8 and 11. And heart 3 and 7. Heart 3 and 7. And on the left side again, on the leg, UB 65, 64 and 67. UB 64 and 67. UB 64 and 67. GB 34 and 41. GB 34 and 41. So that's one group. There's another group. Another group of UB. UB 40 and 65. UB 40 and 65. And GB 40 and 44. GB 40 and 44. So when you apply UB 64 and 67, then you apply the same thing, GB 34 and 41. When you apply UB 40 and 65, then you apply GB 40 and 44. Don't ask me why. You have to go to the class to figure it out. I'm only give you the point strategy. I'm not going to go through everything like all the explanation how you get to the point. It's meridian conversion, okay? I know a lot of you haven't got any idea what global balance yet, or some of you may not know about balance method acupuncture. Don't worry, just need all those points. You see, we have Sanjiao in here, we have UB in here, so it can treat Sanjiao. It can treat Sanjiao. I know you have gallbladder meridian here, you have UB meridian here, so which means it can treat here and here problem from the top to the bottom, from the top to the bottom, from the upper back to the lower back to the legs. Every condition it can treat. This strategy is try to cover all the meridian that related to the back pain, lower back, upper back, legs pain. Okay, so very good strategy. Okay, this is meridian conversion. Of course, you don't need to do all this point exactly the point, but I suggest you do this, follow this strategy point, or you can take off the point and using what? Same meridian, use your image, holographic using image, and that will work too. Right? Stay awesome. Today we will finish this video. Okay, 1 hour. I was supposed to just talk about in what in half an hour, but I go over another half an hour because I don't have to work today. It's my Monday is my off time. Off time. I don't work on Monday. That's it for today. Thank you. And I think I shared with you already. Let's talk about more if you have time. um, the the patient can't control urine and bowel motion, right? It doesn't mean the patient will have a lot of pain in the lower back. Okay, so we see that severe pain, and I have a 70-something years old elderly patient who loved keto, painkiller, and he had a MRI that's showing that compression on the nerve, but it was not too bad. It was not. It's a different problem, and it's this problem. It's a combination issues, and but not much back pain for him, not much. But he had one symptom that he can't control his urine. He has a bit of discomfort, but can't control urine. Bowel motion is okay, strangely. So in your clinical, you may see severe back pain patient, but they can control bowel motion and urine. You may see severe back pain patient, but they can't control bowel motion and urine. But in my case, like the student in China, that what his case was severe back pain, and patient can't walk properly, and with loss of constipation and urine, right? But in my case, it's different. My patient had not much pain at all in the lower back. Bowel motion is fine, just can't control urine. He paid guitar, a few times. He played every day. And he stand up, finishing, pain's weight. And he wasn't sure what's going on. But he can smell it. Oh, it's urine actually. He can't control it, sadly. So the doctor referred to surgeon. And the surgeon had a look. Well, you can still manage, You're not in a lot of pain. Just a little bit uncomfortable. You can do everything you want in life. You just can't control you lost control of your urine. And the surgeon said, no surgery for you. You see, there's some cases surgeon will say no surgery. So he came to me. So I said, well, acupuncture. And there's no immediate relief because there's no pain. Most of the time when he came to me, there's just a bit of stiffness, not much pain at all. Okay, well, that's awkward because I want to test out whether it works or not. Put needle in, is the stiffness there? Sometimes he came here, there's no symptoms. But the only thing that he worried about is the urine. But it's not happening right now. It's only happens sometimes. Okay, so I needle twice weekly. It got better. The urine, he gained control of the urine again. That's it. Happy day. The name of it is Dr. Tan's Magical Back Pain 8 plus 1. Dr. Tan's Magical Back Pain 8 plus 1. 8 plus 1. Okay. So yeah, this is my experience of doing back pain. Okay. And yes, I use balance method acupuncture to treat it. Okay. This is my experience, little experience. You don't see much this case. You maybe see more this case, like Peru and Veronica. You do a lot of acupuncture for poor people, right? So they probably can't access to the proper medical care, Western doctor, and they may, because they may have this symptom. You may see this patient more than others, more than me, you know. Okay, why plus one? Good question. I was worried that you're not asking this question. Okay, yeah, I was trying to. I should. Okay, explain. I forgot about it. For this global balance, okay, it should be just 8. What 8? Medical back pain 8 is 8 meridian. Is small intestine, sanjiao, UB, GB, kidney, liver, lung, and heart. That 8 meridian plus 1. Plus 1 plus large intestine. We use lingual. So that's plus 1. And why plus 1? Because it makes perfect trust. Okay, you have this. We will discuss this because we can't discuss it here. You need to know global balance, 6 balance meridian first. Then we move to global balance, and to let you know what's the theory of global balance, whether how it become a global balance. We need to explain all this. Then further on, magical 8, and you can see the trust, and it missed one line, one stick, probably one trust, that to make it perfectly even. Okay, and plus 1, it can help it make very stable trust. This is what it is. But for you, you may not understand what I'm talking about. But for Veronica, because you have attained the Dr. Tan's balance method, acupuncture, global balance, and local balance, then you would understand. I'm sure you understand what I'm talking about. But for the rest of you, you may not understand. Got it, right? Yeah, got it. But for the rest of it, yeah, this is just the name of it. And yes, there's a theory why plus 1, why not magical 8 or magical 9? Why 8 plus 1? Okay. Well, I hope this. It may not make sense for you if you don't know, if you haven't attained any balance method acupuncture at all. Okay. All right. This is for today. It's an hour, morning an hour now, so I better go. And I'm gonna do more video, and let me know. Put down your question, okay? I want you to give me. Yeah, you did many poor patients. Yeah. What happened here? Because in our country, in New Zealand, so more people, when they have pain or any, the medical system is different. They go to Western doctor first, okay, and in all the severe cases, it may not come to us, okay, unless they have family members, they know us, and they will refer to, unless they go do Google. If they listen to the doctor, they won't come to us. But if in the country that you treat a lot of poor patient, and you have more chance to get difficult case, you have more chance to help people, okay. So I want to share it with you, and I want to encourage you to use to help more people with acupuncture. And yes, Veronica, I would love to go to a country to help the poor people with you, and one day, okay. I haven't got the opportunity, and we haven't. I'm not in the position to fight to you and to help you. yet. But in the future, hopefully, we can manage a team to help you, to go with you. You point in Sancha, very good point. Oh, back pain point in Sancha, yes, yes. Use it often. We use it very often, yet very good. Definitely very good. Okay. Okay, stay awesome and I love you all and I'll see you tomorrow morning. See you. Bye bye. Awesome. Bye bye. I had to close down one by one each of this. Yeah.